It is requested that participants introduce themselves every time they speak. Roll call votes will be taken for every action item. This meeting is also being recorded for the minute taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. Thank you, Mr. Chair.
Thank you, Martin. And can we get a roll call for attendance of the members of this committee?
Yes, Mr. Chair. Sean King, Chair.
I'm here.
Thank you. Deb Poland.
Here.
Thank you. Sheldon Taubman. Giselle Collara McDonald.
I'm here. Good morning.
Good morning. Thank you. Leslie Greer. Holly Hackett. And Mr. Gerald O'Sullivan, a subject matter expert.
Here. Good morning.
Good morning. Thank you. That concludes the attendance for the committee.
Thank you, Martin, and welcome everybody, at least the committee members here. And before we move on into the agenda, I know that we have a number of folks from Access Health joining us as well. If the folks who are here from Access Health want to just introduce themselves real quick before we proceed any further.
Yes, Tammy Hendricks, Director of Health Equity and Outreach at Access Health Connecticut.
Hi,
Holly.
Susan Rich-By. Oh, sorry, Holly. Susan Rich-By, sorry, Director of Legal and Governmental Affairs.
Holly Zwick, Director of Finance, Access Health Connecticut.
Hi, I'm Caroline Ruette, the Director of Marketing at Access Health Connecticut.
And Rebecca McClear, Director of Technical Operations and Analytics here at Access Health Connecticut.
Good morning, everyone. This is Glenn Jurgen, Director of Human Resources, Access Health CT.
Is that everybody? Did we get?
I think that concludes our
Okay,
side. Yeah.
very good. So thank you for those introductions. Welcome, everybody. Moving on to the next items on our agenda. Next, we have public comment. It's my understanding, Martin, that we did not receive any public comments for today's meeting.
That is correct, Mr. Chair. We did not receive any public comments for today's meeting.
Okay, all right. So we'll move on to then review and approval of the minutes of our February meeting. Those minutes were circulated prior to today for the committee members to review. So at this point, I'll entertain a motion to approve the minutes from February 7th, 2024.
So moved, Deb Poland.
Deb?
Yes.
Okay, I can second that. And is there any discussion on the minutes? Hearing no discussion, Martin, can you take a roll call vote for us?
Sean King.
Yes.
Thank you. Deb Poland.
Yes.
Charlotte Taubman. Giselle Collara McDonald.
Yes.
Thank you. Leslie Greer.
Yes.
Thank you. And Holly Hackett. Thank you.
All right, thank you, Martin. Thank you, everybody. So that's 3 in favor. The motion carries and the minutes are approved. The next item on our agenda, turning it over to some of the presentations from our Access Health staff. First up is Caroline has a report on surveys.
Yes, thank you. Again, my name is Caroline Ruette. I'm the Director of Marketing at Access Health CT, and I'm here to share the results of our Lever survey with you, but we're going to start with what a Lever survey is and why we conducted one recently. So the Lever survey was conducted to understand more about the population that's leaving Husky Health programs as a result of Medicaid unwinding, and then also to make some recommendations about how to reduce gaps in coverage based on what we learned. So to ground the whole group on what exactly we did or what we were looking to learn is these kind of 4 things mainly that you see on the screen in front of you. First, did customers know about the Husky redetermination process or unwinding and what they needed to do in order to maintain their coverage? Secondarily, did consumers have healthcare coverage through other means? And if so, what were they? Third, for consumers who did not currently have healthcare coverage, we really wanted to understand why not. And then lastly, what we could do as an organization to reduce the proportion of the uninsured in the state of Connecticut. So that was the driving factor behind this study. And we can go ahead and advance the slide, please. All right, so I'm going to take you through our top 3 findings. These are a little bit dense slides, and ultimately it's to make sure that if you wanted to share these out with any folks that you're working with, that they have enough context in order to really understand what we did and what we found as well. So the first key finding was that most customers who are no longer eligible for Husky Health usually had coverage through a job or a partner. So the wheel on the right are the ways in which the consumers that we surveyed actually had coverage. So survey participants were most likely to have coverage through their employer, and notable populations either aged out of Medicaid and became eligible for Medicare or found coverage through a family member. Notably smaller population moved out of state, so they were not asked to participate in the remainder of the survey. That was about 6%. And they would not be eligible for a QHP through Access Health CT or other options within the state. So that's kind of where our jurisdiction ended for those folks. Other coverage sources, you'll see 12% as other. You might be wondering, what is that? That could be anything from coverage through a school, the military, VA, TRICARE, direct from an insurance carrier, or even a healthcare sharing ministry. We heard a little bit of that as well. And less than a third of the total population surveyed were uninsured. Next slide, please. So our second key finding was that messages from Access Health CT or other state agencies, primarily the Department of Social Services, I want to emphasize that we worked really closely with them to make sure that there was a warm handoff, meaning the Department of Social Services started the communications train, right, since they were Medicaid customers, and then transitioned them over to Access Health CT, where they heard from us about what they needed to do. So this was very much so a joint effort. And what we found that were messages were effective at encouraging consumers to look at their healthcare coverage options. So you'll see on the right-hand side, 46% of those that we surveyed, were encouraged to go to Access Health CT and look at their options. 14% said that they, heard from friends and family. 9% said that they heard from internet searches, which were part of, the last part was part of a campaign that we did. So overall, we reached out directly to folks. We also ran an ad campaign, and we did hear that that was effective at getting them to take action, which is really great news. And we can go ahead and advance the slide. Think one more time here. Thank you. Our finding number 3 was that cost is the largest barrier for the uninsured. I know that this isn't necessarily groundbreaking news, but we do need to understand really what is driving that and what we can do to be better and really encourage folks to enroll and meet them where they are. So let's dive into this a little bit more. So former Husky Health clients that we surveyed who were uninsured cited several reasons why they didn't have coverage. Cost really was that biggest hurdle to overcome. They expressed that they were hoping to get coverage through an employer to help offset that cost barrier, right? Most people who have coverage through an employer have a little bit of help paying for the cost of their plan. So they were really hoping for that. And others faced, some different setbacks, such as not knowing how to get covered or feeling like it simply wasn't worth it, that the value wasn't there, and other reasons like it takes too much time to process the application, that they didn't like the options available, or that their preferred care providers were not covered in the plans available to them. So over on the right-hand side is a full list of the most popular reasons why folks said that they were uninsured. A couple of interesting stats pulled out for you there at the bottom, right? 39% were waiting for their finances to improve. So that cost, again, you're seeing as the barrier. 24% just didn't get around to it yet. It wasn't a priority. There were other more pressing things that they needed to take their time and their money. And 17% were waiting on a job so that they could get coverage in that way. You can go ahead and advance the slide. And in terms of, what are we doing with this data? based on what we learned, we continue to raise awareness about the redetermination process during the cycle of unwinding. That just ended, right? The last 120-day special enrollment period. Folks would needed to have enrolled by the end of July. So we really did this survey towards the beginning and middle of unwinding. And so we knew that that was working. And so we continued to raise awareness about it, mostly through our direct-to-consumer communication, so things like direct mail, email, text messages, as well as an ad campaign. So Access LCT did a campaign, the Department of Social Services did a campaign, and we worked together. So that's that statewide media campaign, and a robust outreach effort, including free in-person events throughout the state to help people enroll. We also know that health literacy efforts are really, really important, right? Down on the right-hand side of the slide, you see that improving health literacy and expanding outreach to groups that are less likely to have healthcare coverage remain a huge priority for us. So we have partnerships with over 2,000 community partners. The team does healthy chat events that really engage like-minded organizations, as well as Connecticut residents, and for that continuous implementation of new approaches to reach targeted populations. And we continue to collaborate with the Department of Social Services so that they are integral in these efforts as well. And we know that we need to, not just drive awareness and make coverage affordable, but we really need to expand what we're doing from a health literacy perspective. And so we are working on some creative ways to help address that point that we will share in the coming weeks and months ahead. So overall, this is a lot of information to digest. We have a full report, and we can make sure that you have a link so you can see all of the data. But these really are the high level learnings and then what we're doing based on what we learned. And I'll go ahead and pause there for any questions.
Are there any questions for Caroline?
All right, hearing none, we can go ahead and advance the slide one more time.
Well, Caroline, I was just waiting for others to raise their hand or something. I did have a question. Can you kind of refresh us, because maybe I knew at one point, the relative timing of the survey in comparison to when the bulk of this population was redetermined and went without insurance, and then we learned some of these things about why this subpopulation remained uninsured, and then do we have any feedback yet on subsequent to the survey if there were any effective strategies that were utilized to, educate folks or help them find something that they did find affordable if they thought maybe it wasn't affordable at the time they filled out the survey, that kind of thing.
So the survey really is a snapshot in time. And since unwinding was a full calendar year effort, really, there wasn't necessarily a way for us in this particular effort to really follow people along that journey, which I think is part of what your question is. But what we did find ultimately is that most people are insured through other means, right? There's not necessarily the vast majority of folks who went uninsured. But there still is a population that we need to go after as a result of that. And we did learn that probably the most effective way at getting at these people is twofold. One, direct to consumer communication. So when we send them something in the mail, when we send them an email, when we send them a text message, that is effective at getting them to come in and look at their options, as well as in-person help. Offering those kind of events throughout the state continues to be really, really effective so that people can ask questions, get the help in person, in language. That was the biggest learning here. And I know that that might not sound like groundbreaking news, but until we do a survey and really talk with people, we don't know if what we're doing is working. The thing that remains to be seen is a bigger effort on health literacy, helping people truly understand what benefits are available to them, especially through the ACA plans, and what financial help is available to them as well. And so there are several efforts underway right now to help with those types of things, and we look forward to offering some new creative solutions as we move forward as well.
That's great, and you really got at kind of what I was looking for there. But
Sure.
So out of the folks who, and we presume we can extrapolate this, right? So out of the folks who responded to the survey, 29% said they were uninsured. So it's probably somewhere in that ballpark for all of the people who were redetermined. And then following how much do we have any sense of how much we've been able to chip away at that 29% number subsequent to the survey through those strategies? How effective are those strategies, especially the direct contact?
Yeah, so now that unwinding is officially ending, right? Because that last wave of people who were affected by unwinding had until July 31st. We're just now able to start digging into the data to truly understand whether the snapshot in time was actually representative of the entire experience for everyone, because that may or may not be the case. So I can't really confirm that in this meeting, but we are looking to, we regularly do look at the data every single month and provide some updates. But we're looking forward now that unwinding is completed, right? Since that special enrollment period just ended a week or a week and a half ago, to really looking at the full scale and truly understanding what was the total population that was uninsured and how effective were the communications and the in-person events and what else can we do? So I think we're all getting at, the same things, really wanting to understand what we can do for that population that might not be uninsured. And now is the time that we can really look at it in full scale rather than just the survey responses. And so we will come back to you and provide an update on that.
Excellent. Great. Thank you so much.
Sure.
All right. Go ahead.
All right. And honestly, this is just a big introduction for another survey that we're doing, folks. We really want to understand the impact of the Patient Protection and Affordable Care Act, known as the ACA, now that we've been in the Connecticut communities for more than a decade. So ultimately, the goal with this survey is to get some qualitative and quantitative feedback to understand how the ACA has impacted the health and well-being of Connecticut residents. We're doing a survey online and over the phone in both English and Spanish. And the audience includes both QHP, Qualified Health Plan customers, as well as Husky D customers who were included in that kind of expanded Medicaid under the ACA and who have been enrolled for the past consecutive 5-year period. And we chose those demographics to make sure that we were surveying an audience that had been a customer of Access Health CT, either through QHP or Medicaid in that expanded portion as it relates to the ACA. For some time, right? Some time would have to have elapsed to understand truly the impact on their lives in terms of health and well-being. So those are the demographics we pulled, and we look forward to bringing you our high-level learnings and then what we're going to do about it at a later date, much like what you just heard about the Lever survey. So now that we've been around for a while, we're really trying to, use data-driven insights to get better at what we do for the populations that we serve. And so surveys are a great tool for us to do that, and we'll continue to do that and share updates with you as we move forward. Any questions there?
For me.
Probably a little cart before the horse. We'll get back to you with some more details later. Thank you for your time and attention. Really appreciate it.
Thank you, Caroline, for that presentation and for the answers to questions. Trying to catch up on time now a little bit. I guess I spoke a little too long asking my questions, but next we have Tammy is going to give us an update on Broker Academy. I think we had a successful summer. Can't wait to hear more. Go ahead, Tammy.
Yes. Thank you so much, Sean. Good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach. I'm hoping everyone has had a great summer so far. It's coming to an end so quickly. I also forgot to mention earlier, unfortunately, James could not attend our meeting due to a medical appointment. He sends his apologies, and we will be sharing updates with him after this meeting. But I'm excited to present on the recent Broker Academy class, year 3. The program continues to grow. We started by accepting students at the beginning of May, and we rolled right into program readiness meetings. These are just weekly meetings that we held to prepare the students for the actual in-person class. So we covered a variety of topics. We went over the Kaplan portal, right? They had their study guides there. They had their the information on the class. We taught them how to navigate it, right? It's filled with study materials and all those good things for the students to get acclimated to the materials. So we had about a month of those meetings leading up to the in-person class. We did see a decrease in the class size overall, which was to be expected as previous years. The main reasons students were not able to come to the in-person class, from what we learned, was lack of transportation, lack of childcare, and not being able to take time off of work. Those were the three main reasons that students gave us for not being able to come to class. So in total, we had 35 students in Hartford, 18 students in Norwalk, bringing our total students to 53 for Broker Academy Year 3. But even with that, with the attrition, the combined class size was still 35% more than last year. And there was also still a 75% increase in the Hartford class size, right? So we almost doubled that class size there. So we still experienced a lot of growth this year, and I'll share some stats on the class. So starting with gender, 77% identified as female versus 23% male. Every year we've seen this trend with the classes being majority minority female. And as you all know, the broker industry is quite the opposite. So it's always interesting to see that statistics there. 71% of the class were between the ages of 36 and 65. Again, we've seen this in previous years. Many of the students had not been in school for years. So this really ties back to the importance of the program readiness meetings, right? Meeting with them leading up to class, getting them prepared, making sure that they're comfortable with the materials. 42% of the students were African American, 27% Hispanic, and 13% white. We also had some smaller percentages that identified as multiracial and Asian. So really good mix there. 65% of the students were from Hartford and Fairfield counties, right? In respect to the classes, which were held at Capital Community College in Hartford and Norwalk Community College, which would be in Fairfield County. And this is a big one. Students collectively were from 26 different towns, representing 6 out of the 8 counties in the state, which really highlights the growth of the program. Students were coming in from all over the state to attend class, and we were really happy that we had such a huge growth in the program. And finally, the in-person class. We did a fairly new schedule this year. We had the 3-day in-class training. We're happy to report all the students passed that class certification, which is important because you need the certification to move on to the state exam. We were also able to schedule all of the students for the state exam while we had them in class. And so on the following day, we had a review day. The students came back, the instructor was present going through the materials, and that was a new thing that we added this year, an entire day of review. And it really gave the students an opportunity to ask more questions before going into the state exam. The final day, again, was new for us. We offered students the opportunity to take the state exam on location, either at Capital Community College or Norwalk Community College. It was they would take it virtually. Some students opted for this as they felt more comfortable taking the exam in a familiar environment. And others decided to go to a testing location or take it from home. But we were really happy to offer that to students who felt more comfortable taking the exam in a place that they did the training. So far we've had 23 students that have passed the state exam, and they are all matched up with mentors right now, going through the mentorship portion of the program. And the biggest plus of doing the schedule this way, not only did students have the opportunity to take the state exam much sooner than in previous years, but they were also able to start the mentorship program sooner, so they have extra time with their mentors. So I know I went on a lot about that. I'll pause here if there's any questions.
Any questions for Tammy?
I do. Tammy, it's Deb Poland. Hi.
Hi.
Can you remind me how many weekly meetings were there preparing for the in-person class?
There were 5 weekly meetings.
So essentially it was a 6-week program, right? 5?
Yes.
How long were the weekly meetings?
They were about an hour and a half, 2 hours. And in between that, we were meeting with students on a regular basis individually as well. So we had a lot of questions leading up to it. But yes, as a group, we met once a week. Individually, I would say we reached out to each student on a weekly basis as well, on top of the weekly meeting.
Thank you.
You're welcome.
Tammy, I had a question about the state exam. So we've had, 23 out of 53, almost half, close to half have passed the state exam and gotten paired up with a mentor. What additional support do we provide for those 30 students who still, maybe they haven't taken it yet, maybe they tried once and weren't successful and need to try again? So what are, do we have any information on that and what we do to continue that support until they can get, because obviously we want all 53 in this workforce and helping their communities. So what do we do there?
Yeah, so the students that have passed the exam and they're in the mentorship portion of the program, they move on to our broker support team. So John and his team are keeping up with them on a weekly basis while they go through the mentorship portion of the program. The remaining students who have, actually most of them have taken the exam at least once. My team continues to follow up with them and provide them with other opportunities to take the exam. So we do give 2 vouchers per students, and we are willing to accommodate if they do want to take it more than twice as well in special circumstances. There have been times where, students have gotten kicked off of the virtual test taking website because they moved or they got up and so they got canceled, right? So we've made some exception for those students, but we do continue to follow up. Summer is just really hard for a lot of folks. They have their kids, they have work. So we do continue to follow up on a weekly basis, Sean, with those students who have not passed the state exam to help them cross that finish line. So we do go in well into open enrollment with that. And then we kind of wait for them to reach back out to us if they need anything else, but we do follow up.
Great. Thank you. Do you afterthought, do you have any, do we have any information from the last cohort last year about, how many of those folks were unable to eventually pass the state exam?
Yeah, so last year we had 40 total students and 21 passed the state exam. We have gotten requests from students who, wanted extra time, and we do meet with them, the one-offs that do come back around. But 21 students passed from last year. The other students really have not reached out or have not expressed interest in taking the exam again. Unfortunately, especially for this population, it's hard once you go through a new experience of training and then you don't pass the test. It could be very defeating. And so that's another thing that we're working on with a lot of the students is motivating them to try again. That's another big step. It's a huge hurdle for us, but it's something that we continuously work on.
Okay, thank you.
I have another question. This is Deb again, but I don't know. It could be coming up on the next slide. Do we have any idea where they're working once they've passed the exam?
We track it sometimes. Many of them stay with their mentors, but we have had a few students who have opened up their own agencies. I would say offhand, I know of 3, but a majority of them do end up staying with their mentors or going off on their own. But we haven't officially tracked where they're employed, and that's something that we can definitely consider, Deb.
Thanks.
It'll be interesting. Yeah.
Okay. Hearing no other questions. Thank you, Tammy. You're still up on the agenda, but Susan is going to join you for an update on the DACA recipient eligibility. So go right ahead.
And Susan,
thank you very much. Yep. Thank you, Tammy. Thank you, Sean. Susan Richby, Director of Legal and Governmental Affairs. We wanted to update you on some positive changes that the federal government made in a final rule last May to allow DACA recipients, deferred action for childhood arrivals, to now be considered lawfully present and be able to enroll in a qualified health plan and also receive financial assistance. And in states where they offer a basic health plan, they can enroll in that as well. So this rule goes into effect November 1st, 2024. So anyone who falls into this category could come in and enroll through a special enrollment period in November to get coverage in December if they wanted it, or they can just enroll during the normal open enrollment period for coverage starting January 1st, 2025. So this rule changed the status for DACA recipients, and it actually caught them up with other deferred action groups. There are other deferred action groups under immigration law, not just childhood arrivals. Those other groups were considered to be lawfully present for purposes of enrolling, and the federal government decided it was time to make the change to include the childhood arrivals along with those other deferred action categories. I will note this change right now is only for enrolling in a plan through an exchange, a QHP through an exchange or a BHP. We don't offer a BHP in Connecticut, but in states that do. And the financial assistance through the tax credits and the cost sharing reductions. When the proposed rule came out, they were considering also extending that change for eligibility in Medicaid and the Children's Health Insurance Program, known as CHIP. But at the time when they made this rule final in May, they did not make that change for Medicaid and CHIP. That may come at a later time. So we're very excited. And, it opens up coverage avenues for a few thousand people, I believe, are DACA recipients right now in Connecticut. And so we've made changes to our system, and we will be getting new information that we get from Department of Homeland Security about immigration status for recipients, for enrollees or applicants. So they'll be able to enroll through our system starting November 1. And I will turn it over to Tammy. She and her team have put together a terrific outreach plan so that people who fall into this category are aware of this great new opportunity for them.
Thank you, Susan. And so to expand on that, we have created a plan to reach the DACA, or we like to call them the Dreamers. First, we have to start with where they were located. And we looked at data directly from the U.S. Citizenship and Immigration Services. So as of 12/31/23 in Connecticut, there are a total of 2,800 individuals, 2,830 individuals to be exact, that are registered. Top locations for this population were noted as Bridgeport, Stamford, and Norwalk. These locations were no surprise to us because we work with a lot of community partners in these areas, and we know that there was a need. So our outreach plan really starts with collaboration and training. Currently, my team is in the process of planning a meeting with key organizations and even a few immigration lawyers to get their feedback on our outreach plan and how we can improve it, how we can better reach and serve this population. So we're looking to secure a date and location for this meeting, and we will have a follow-up once we conclude that meeting, and there will probably be multiple meetings if needed after that. But that will be a great start for us. Now that we have the locations, we want to activate community partners in each of those areas to partner with us and help us reach that population. In addition to that, we have our monthly calls for community partners as a whole to provide updates and get feedback as well. And this is an open call for any and all community partners that we work with. We also cover other topics and updates as well. So if you know of any community partners that are interested, any community organizations that are interested in attending these calls or partnering with us, we are more than happy to connect with them. And finally, all of our presentation materials have been updated. Our marketing team has finalized a flyer that we can share with our community partners, which will be great while we do our outreach to have that as a leave behind. And also the yearly trainings for the brokers and CACs will be updated with this information as well. And finally, going into the open enrollment period, we will have our enrollment locations open and available. One will be in the main area, Stamford, which will be open all week throughout open enrollment. We also have our local navigator locations that are close to those top 3 areas that can accommodate and do enrollments as well. And throughout the open enrollment period, we will have 24 enrollment fairs throughout the state to try to get this population. So we're working from a lot of different angles, but the most important part is that we are really working closely with our community partners that are close to this population to make sure that we get as close to them as possible. And I'll pause here for any questions.
Any questions about the DACA outreach and coverage? Hearing none. Thank you, Tammy. Thank you, Susan. And we can move on to community outreach. And Tammy, you still have the floor.
Oh,
Right
you
ahead.
are going to hear quite a bit from me for the rest of this meeting. Thank you so much. So, of course, open enrollment planning is well underway. We get a lot of requests to hold fairs and at different locations, but unfortunately, we can't accommodate all the requests. So I thought it would just be helpful for us to go through kind of how we pick the locations for our fairs. And there's a few things that we look for, right? Is this a location that's in an area of high need, or is there a higher uninsured rate in this area, right? We typically plan our outreach around these high need areas, and we focus on usually the top 10 locations that have higher uninsured rates in the state. We also look at, we focus on different special populations, right, and where they're located. So we also look at how these areas perform in previous years. And probably the most important factors is the location easily accessible by bus or car? Is there parking for convenience, right? We know that sometimes it's after hours. We don't want people to have to walk, to get to the location to get enrollment. So those are all things that we look for. And inside the building, is there adequate space to do the enrollment? A lot of personal questions are being asked. We get a lot of organizations, hey, can you hold an event? And then think we can set up in the hallway, but that's typically not a good place, right? That people want to have an open conversation about health insurance. So those are kind of the things that we look for when we are planning our fairs and our events. Again, as I mentioned on a previous slide, we will continue to have presentations and meetings for our community partners and consumers, keeping them up to date on any new changes as we move through the open enrollment period. And then we have our enrollment locations and fairs. So again, we have 2 locations. One will be in Stamford, one will be in East Hartford Library. These locations are open during normal business hours. And then to supplement that, we have the 24 fairs planned throughout the year. Throughout the open enrollment period. And those are typically held after hours or on the weekends to get those folks who can't make it in during normal business hours. And on top of that, we have a whopping 655 certified brokers. I think our director of small business and development mentioned that this was one of the largest number of brokers that we've had in recent years. And we have 228 CACs, certified application counselors, throughout the state. And that number continues to grow as we work to to promote that program to organizations. So there's been a huge decline over the years, but in the past 3 years, we've seen that number climb back up, and we're happy to see that. I'd like to add one more thing to this slide. We have our community conference event, our annual community conference that will be coming up in October. This is a really important event for us to kick off OE. Typically, we have around 100 plus community partners and brokers gathered together in person, which is fun. And we cover a variety of different topics to get them prepared for OE. So it will be held in Waterbury this year. We are in the midst of planning that. So we are really looking forward to that, and we will share the details with this committee once everything is finalized. And I'll pause here if there's any questions.
No question. Just a quick comment. This looks great. I'm excited that that we're able to continue this level of outreach and target all those important populations that we need to catch. You know, if I remember correctly, 2024 was the largest enrollment through the exchange since it began, and hopefully we can continue that trajectory with the next open enrollment year. Thanks, Tammy.
Absolutely. Thank you.
And then Tammy, just this is Deb Poland for the record. So the CACs need to get certified every year, just as a reminder for those who are watching. And when is the training available for them?
I think it starts in September, but I will double check with Gina on that. But I believe it starts in September. Yeah.
Thank you.
Thank you so much, Deb. Hey, great. I just wanted to give a quick update on some other outreach things we have going on, as if we don't juggle enough. So some statistics on our outreach events. We've had 97 visits to different community partners so far as a team. And I just want to remind everyone, we have a very mighty team of 5. So we do these in between the meetings and other events that we have planned in sponsorship. So 97 visits to our community partners throughout the state. We've had 279 outreach tour events. These are events that we attend for other organizations. And we've had 97 Healthy Chat group presentations throughout the year so far, year to date. So those are always important for our consumers and for our community partners. And we hold them on a monthly basis. And we also do them if a community organization requests. We've also expanded the Navigator program this year. We have 4 returning navigators, Community Renewal Team in Hartford, CHC ACT. We have Greater Bridgeport Area Prevention and New Opportunities. And this year, we're happy to announce our newest navigator, Cornell Scott Hill Health Corporation in New Haven, really important area for us as well. So we're happy to be able to expand this program and get a new navigator this year. And I've also covered the annual community conference on the previous slide, but lots going on for us. We attend a lot of events, we host a lot of events. So we really just try to make sure that we're reaching our community partners and consumers alike in the areas that need the most help. And I will pause here.
Any additional questions for Tammy on outreach? Okay, so the next item on the agenda is our strategic initiatives. As mentioned, James is not here. So Tammy, are you gonna continue to present on his behalf?
Yes, I'm going to continue my role here.
Thank you.
Finally, to wrap up here, I'll try my best to fill in for James. I wanted to provide a high-level overview on some strategic initiatives that we are working on right now. We are really looking at different ways to improve the customer experience. One of the first things we are working on, and it's been months in the works right now, is our application system. We've been working with internal teams. We've formed internal teams as well as conducted interviews with external stakeholders on how we can improve the system and what that would look like. This is underway right now. This project is being led by our Director of Operations, Gina. She has quite a heavy lift, but we have gotten some really great feedback and findings from our marketing team at Mintz and Hoke. So we continue to work through that. Gina is also working on a call center RFP that was issued on July 12th. Again, looking for new call center vendors, and that is a key part of the consumer experience. We know the call center handles high call volumes, and we want to make sure that we have a vendor in place that can accommodate and make sure that our consumers are getting the best experience. And then finally, we have ICHRA. We are missing an H on that. My apologies. I mistyped that. Individual Coverage Health Reimbursement Arrangement. Say that 3 times fast, which is a different, it's a different type of health benefit. It's an employer-funded health benefit that allows businesses to reimburse employees tax-free, I believe, for individual health insurance. And Susan is on the line to correct me. We are in the process of, John and his team is in the process of going through an RFP to pick a vendor that will actually host that platform. And so all of these things are in the works. We are happy to get more information for you if you have any questions on any of those specific initiatives.
Just one quick question about the call center RFP. I don't know how much you can answer or go into detail about this, but just kind of curious. My sense is over the years, the call center operation, depending on, and there have been a few different vendors over that time, has steadily improved, I think, over the course of the last decade. Are there any sort of repeated issues that vendors tend to have trouble with that the RFP may be focusing on, or the decision may be focused on, or, you know, like I said, you might not be able to really answer that, or you might have to dance around a little bit, but just kind of curious what you can add to that.
Yeah, I might have to dance around at that a little bit, but here, Susan can jump in.
I can jump in. You know, as you know, Sean, we have been with the same vendor. The vendor had a corporate transition, so it was originally Faneuil for several years, and Faneuil was acquired by a company a few years ago called TTEC, and that is different from the original call center vendor that we had for several years. But we have been with this Faneuil TTEC vendor, if you will, for a number of years now. I think since 2016. So part of, you know, issuing the RFP is to really go out and look at the market. You know, technology changes. You know, we've gone through the pandemic. Call center workers primarily work remotely now. So we're really just, you know, we did an RFI, I believe, last year too, to gather information about what's going on in this space and advances in technology. So we really want to go out there and look at sort of everything and what's the best possible, you know, service. To Tammy's point, all of these initiatives are focused on improving the consumer experience. And yes, they have, you know, improved greatly over the years from, you know, our start many years ago. But seeing how can we continue to improve that? How can we integrate those improvements in technology with some of these other initiatives maybe that we're looking at, and obviously also managing the cost. It is probably either our top single cost or our second to top, single largest cost. And we do share the vendor with the Department of Social Services. We have the contract with the call center vendor, but they provide services for both Access Health Connecticut consumers and also consumers enrolling in the Medicaid and CHIP programs that come through our system. So we're just always looking at, all of those factors to see how we can come up with the best fit and the best bang for our buck.
Perfect. Thank you.
Sure.
Thank you, Susan.
Any other comments or questions regarding the strategic initiatives? All right. Well, thank you, Tammy, for doing the heavy lifting today and getting us through all that material. It was a lot of great, useful, helpful information. I appreciate all the work that you do and your team does over there at Access Health, everybody's contributions. It's always good to hear all the good work that all of you are doing. With that, I will make a quick call for any future agenda items if anybody has anything to add for the next meeting, other than what may have been discussed earlier in this conversation. Hearing none, I will entertain a motion to adjourn then.
So moved. Deb Boland.
It's moved by Deb. Any second? I'll go ahead and second. Any discussion? Hearing none, all those in favor. Oh, nope, we do a roll call vote on this. Sorry, go ahead.
Yes, Mr. Chair. Sean King,
Yes.
Deb Poland,
Yes.
Sheldon Taubman, Giselle Carrera McDonald,
Yes.
Leslie Greer. Okay, thank you. Leslie Greer
Yes.
and Holly Hackett. Thank you.
All right, thank you. That's 3 votes in favor. The motion carries. Thank you so much, everybody. Good to see you all. Appreciate the discussion. I look forward to the next time we get together.
Thanks,
Thank you so
everyone.
much, everyone.
Have a
Take
good day,
care.
everybody.
Thank you. Bye.
Bye.